Hello, Vetfolio Voice friends. You're back again, and I'm so happy that you are for part 2 of the discussion among myself, Dr. Dana Varble, and vet students Amelia and Kaitla. I know I said I'd keep the last intro brief and failed miserably at actually doing that, so here is attempt number 2. Let me introduce you to everyone. Amelia Matzik is a third-year veterinary student at the University of Glasgow in Scotland. She grew up in Pennsylvania and eventually moved to Chicago to attend Loyola University and pursued a degree in forensic science. She's gained veterinary experience all over the world, including South Africa and Thailand, further fueling her interest in exotic animal practice and wildlife research and rehabilitation. Kaitla Wildblood is also a third-year veterinary student in Scotland at the University of Glasgow. She's from California and earned her bachelor's degree in animal science with a minor in equine science from Cal Poly. She's interested in mixed animal practice, with her primary focus being equine and a splash of small animal medicine. And then there's Dr. Dana Varble, Chief Veterinary Officer for the NAVC. She earned her DVM from the University of Illinois in 2003. Where her non-traditional clinical rotation schedule allowed her to fulfill clinical requirements in multiple locations, including the University of Illinois, the University of Tennessee, Louisiana State University, Brookfield Zoo, and the University of Pretoria. She's practiced in clinical medicine, in exotic pet practice, small animal general practice, and emergency medicine, and is still a practicing veterinarian. She's a nationally and internationally recognized speaker and author, particularly in the areas of herpetological and exotic animal medicine and surgery. She joined the NAVC in 2015 and, with some stops along the way, is now Chief Veterinary Officer for the NAVC. Our conversation was lots of fun, and I loved hearing all the different perspectives on veterinary medicine. Okay, I think that was relatively brief. Let's go ahead and get into the episode. All right, so thank you for joining us for this second episode where we're talking to Dr. Dana Varble, and then Amelia and Kaitla have joined us again to continue our discussion about vet students and their paths through school. We have just had such a good time with this discussion and talking to each other that we figured we would keep it going and thought you guys might enjoy it too. So let's jump in.
Thanks for being willing to have us back again.
Yeah, definitely. Thank you.
Oh, thanks for coming back. I mean, truly, I'm so glad we could do this again. It was so much fun the first time around. I was sad to have to cut it off.
It's always interesting to hear. I love talking to students. I always have, because I think it's interesting. I mean, if anything helps keep you aware of how vet med is changing, it's to talk to students every few years and see what their thoughts are and how their perspectives change. Because I do feel like every time I talk to students, something new pops up, some sort of new advantage, but new challenges too. So, I mean, it's going to be a couple of years at the most, and you're going to be here, and you'll be talking to another. I know. You guys just saw Amelia's face. It was hilarious. But it is really funny because, like, one of my mentors, and I'm not sure if you guys have met him, Dr. Mark Mitchell, he'd always refer to us as Dr. Whatever your last name was. And it was funny because the first few times he referred to me that, I'm like, oh, don't call me Dr. Varble. I'm not used to it yet. He's like, but you will be. So why not now?
Let's get started.
And I was always like, that's nerve wracking. Okay. But it's true. He was right. It's only a few years before, what you guys are doing, what you're experiencing is going to be just as much part of the profession as everybody else. So it's good.
Yeah. In the moment, it definitely feels like it is taking so long to get there. And that, because becoming a veterinarian is something that I've wanted to do, like, literally since the age of 4. I have the papers from like kindergarten when you have to write down, oh, what do you want to be when you grow up, and like all about you and everything. And you can see in my 4-year-old handwriting, veterinarian. So I've been wanting to get to, this point for so long. And now it feels like I still have another 2 years to go, but I know it's going to fly by because where I was 2 years ago feels like yesterday. So it's exciting, but very scary at the same time to know that in just a couple of years, I'll be a doctor also.
I love that you referenced your 4-year-old handwriting. I have a 4-year-old, and she recently was like student of the week. And one of the questions they ask her is, what do you want to be when you grow up? And you guys think I'm going to say veterinarian. I'm not. She said she wanted to be Darth Vader.
Oh my gosh,
Solid
second
awesome.
choice. Solid second choice.
I wasn't quite sure how to feel about it. I was like a little proud, a little concerned, but that's kind of sums up my relationship with my 4-year-old anyway. So. Oh, I was going to say, Dana, I don't know if you ever get used to being called doctor, because have you had the experience where you call in to the clinic, maybe on a day that you're not working, and, you know, you don't want to be like, hey, it's Dr. Fleming calling in. I'm not that cocky. And so not that it is. So you call and you're like, hey, it's Cassi. I just had a question about this. And you go on for like a couple of minutes. And finally, whoever you're talking to is like, who are you?
But mostly with the emergency clinic, because the shifts are so different. So you don't always work with people on different shifts, because when I worked at ER, I worked mid shifts and night shifts. So the people that like roll in at 6 a.m., 7 a.m., especially like our customer service reps, have no clue who I am. They have no clue. They're like finishing their day when I got in, and I'd call in and be like, hey, it's Dana. And they, I'd be like, hey, can I talk to so-and-so in the back? And they'd be like, what's your pet's name? And I'd be like, and of course, if you're really not paying attention, you're like, my dog's name is Hannah. And they wait, but no, she's not there. Hold on. Wait, let me start over. And you have to then you have to go back. You have to give context to like the whole. Okay, wait. I'm Dr. Dana Varble. I work there sometimes. I'm trying to call this person because of this reason. Can I talk to him, please?
So back to question number 1.
Yeah. I mean, luckily Amelia knows our exotics clinic is so small. Like, I could probably call them and be like, yo, what's up? And they'll be like, Dana, what? Totally different.
I just have this vivid memory of when I first started working there, because at the time I was only part-time and you were also only part-time. So for the first couple months, I maybe ran into you twice because I was working while I was doing undergrad. And I just remember I was working the front desk and you called and you were like, hey, it's Dana. Can I talk to Steph? And I was like, who are you? and you were like, it's Dana. Who are you? And I was like, this is Amelia. And you were like, who's Amelia? It was a circular conversation for a full 30 seconds.
Going nowhere. I also always have this panic moment that I think, did I dial the right number? Am I on the phone with somebody at their house right now, and and I'm going on and on about who I need to talk to in the back, and they're like, dude, no. Yeah, very long story short.
So speaking of circular conversations, you never totally get used to being called doctor.
Yeah, how do you deal with that, I guess, imposter syndrome of, because obviously right out of school, I know, that I'm sure I'm going to be like, oh my gosh, how have I graduated? But how do you deal with those feelings, a couple of years out from school?
Well, one, it doesn't go away.
I was going to say, I'm going to let you start this one off, because I still do.
It doesn't go away. I mean, in a way, veterinary medicine is so it is also advancing so quickly. So I think part of it too is you're always like, oh, do I know enough about the subject? Do I know the latest? Do I know the best way to handle this? I know what I think I know, but is that really every year new drugs come out, new methods come out, new techniques come out. So I think some of it is just realizing you don't necessarily need to know everything, but you need to know who to call, where to look it up, what to do. And then stop looking behind you when someone says, hey, doctor, is also, that's pro tip, stop frantically turning around and going, wait, oh, me, you mean me? And I'll say this, at different practices have really different cultures surrounding this. So some are really casual and hey, you is fine. And I don't, and I'm not the type to be like, oh yeah, don't call me hey you. One of the clinics I worked at was really adamant. Medical director there really liked the doctors to be called doctor, doctor last name. So it was really funny there when we were feeling casual at that practice, they just called me Varble. And it is really funny because I'm still friends with a couple of techs from there, and I've never heard them call me Dana. Not once. Like I'm Varble to them. That's the way it is. It's hilarious. I'm like, oh, cool. All right. I can roll with that. But and other practice cultures are just, they're a little bit looser. The text would be more, and the assistants would be good about introducing me as Dr. Varble to the clients. And then in the back being like, hey, Dana, what's up? So a lot of variation there, but I think some of it too is just at some point you realize you're not going to know everything. So it is what it is.
Can I sneak in another question?
Yes.
Do you think that it matters how you present to yourself to clients with regards to calling yourself, doctor, your last name versus saying doctor, your first name versus, do you think that matters at all with new clients or?
So I'd be interested to hear Cassie's take on this because we have worked in such different areas of the country. And I've noticed there's regional and probably international differences.
Probably.
When I've presented internationally, I've definitely, certain places are a lot more Dr. Varble. And, then you go to Australia and everyone's first name. They are. They're very casual. It's not a sign of disrespect by any means. That's just what they are. And I have certainly noticed that some clients actually respond better when you're a bit more casual. They feel like they can talk to you and relate to you. You don't seem like the white coat effect sometimes intimidates certain people. And again, I think it's cultural, it's different. But like one of my favorite practice cultures was like, they were really casual. It was out west. So I will preface it by that the geography of, and the culture of that area was a bit looser. And like, we had no real like dress code per se. And now granted, I never showed up in sweatpants and a t-shirt just to challenge it for fun. But like I routinely wore like jeans and a button-down shirt into work every day and had more luck. I felt like could be more myself and communicated with clients much easier than if I was wearing a white coat and scrubs. But I think you're going to find that there's pretty different geography. And I always love talking, Kayla, I know you really like this. Our mixed animal folks are always like, yeah, I'm just happy if I don't smell real bad. There's like a whole different, like looks and how you present yourself are very different in, especially in a mobile or even in a clinic, large animal practice. Like, no one's expecting them to not have mud on their shoes. It's just the way it is.
I've gone to wearing, I'm most comfortable when I'm working in scrubs in a clinic. That's where I feel like I can kind of feel like myself. And then if somebody passes me like, a bloody dog or, something that has poop all over it, then I'm not like, how do I, I still am a little bit, but, I'm a lot more, okay, it's easier to get dirty and stuff like that. And I feel that's where I feel comfortable. As far as like presenting myself to clients, I've only worked in the Southeast. So I don't have like the diversity in my experience. I feel like lately I've been introducing myself as Dr. Fleming, but the primary reason is I've had a couple things happen. What I used to do is say, hey, I'm Cassi Fleming. I didn't care what they called me, like Doc, Cassi, Fleming, whatever. It did not matter. And I'm still fine with that. But I've had a couple of cases of one, apparently my first name is hard to understand and repeat back, especially with a mask on. So I get called like Cassidy and Casey and Kathy. And so I was like, all right, I don't want to like spend 5 minutes of our time, like just you figuring out what my name is. So that made me kind of go to Dr. Fleming. And then the other thing is I had people ask me like halfway through the conversation, they would be like, I'm sorry, who are you? Like, are you the doctor? And I was like, oh, yes, I'm sorry. Like, yes, I'm the doctor. So I still don't, plenty of people down here, like doc is really common, they're like, hey, doc, how's it going? I don't care what people call me, as long as I don't introduce myself to the doctor and then you turn around and go, oh, hi, Miss Fleming. I'm like, no, we're going to use titles. Like, that's what mine is.
Yeah.
Let's back that train up. But in general, I don't care. But I've gone to introducing myself as doctor just because I've noted some confusion. And I wonder if some of that will go away when we get away from curbside and it's not like this weird exchange and they can kind of see the flow of the appointment and stuff like that.
So it is interesting because I almost do the same. I always introduce myself as Dr. Dana Varble. And then I kind of let the clients first of all, and it's bad, but 90% of them forget your name immediately.
Yes. Oh yeah. At the end, they're like, "What was your name again?"
Yeah, they're like, who?
Which I do the
who?
same thing. Like,
Yeah.
no judgment.
It's because especially with curbside, it is really hard. Like they're not focused on your name. They're focused on hearing that everything is good or everything is bad, or here are your options. And I get it. I don't sweat it that much, honestly.
I mean, speaking of curbside, how do you think that once COVID kind of settles down, how do you foresee vet meds swinging back, or do you foresee some clinics kind of staying in the curbside direction?
I mean, I want to go back. I know I'm probably in the minority there, because a lot
Me
of people
too,
like
me
curbside.
too.
You do too? Okay, that makes me feel better. But
Yeah.
man, it's like to have a dog, which first of all, if there are pet owners listening, animals are doing amazing in the clinic. Like, do not stress about your animal. We love them and are taking great care of them. And the stress level for the animals, I think, is so much lower because the clinic's quiet, there's less going on, and we can just kind of get them in and out. So no worries there. But, if you have a pet and you find a lesion, and then to try to go out to the car and like describe that to the owner and be like, this one spot on his side, kind of low, but it's where that brown spot, and it's really hard. So man, I can't wait can you just stand there in the room with me and let me say, see this spot? We should do something about this spot.
Yeah. So I'm going to be, we are probably both in the minority, I guess, because and Amelia knows is where we practice. There's no way I'm going and standing out in that parking lot and shouting. It's a lot
over the trucks.
It's a busy street.
Yeah.
It would literally be me standing outside their car screaming at them, and it would not be like, there's no way that would be an effective.
So it's like a no-win, because you can either go out and scream, but you at least get the body language and stuff like that, or you can talk over the phone where you lose all nonverbal communication. And by the way, we're veterinarians. That's what we do, is nonverbal communication.
Yeah,
it's true. And so for me, I see it. I think it'll probably be really gradual. I think it'll be single clients, exam rooms only. I just had this conversation with someone in a different media interview. I don't know that waiting rooms will ever be utilized in the same way again. And, in retrospect, it's not really a great place. I mean, there's a bunch of animals in there. Dogs are barking. They're anxious. They're just, the clients are stressing each other out. I mean, if you've ever seen a client that's angry or distraught standing in a waiting room, feeling very exposed with all these people around staring at them, you just start to wonder, like, who is this? What is this waiting room? Is it doing any good for anyone?
Right.
The clients is not good for the patients. It's really not good for us. I mean,
the walk through the lobby. And I mean this with the best of intentions, but like, I just got to walk through the lobby to tell the receptionist something. Oh, hey doc, while you're here, and then like 10 minutes later, you're like, oh, now I'm so behind.
Yeah. Well, and it's easier for me. Like you can't have communication with clients up there. There's too much going on. They're distracted. It's not a great use of space. Like, I'd much rather throw another exam room up there or do something else, or I just think there's better use of, vet clinics are small, and I'm just not sure that that's ever going to be a great use of space again. I think if they come back, they're going to be tiny, tiny, tiny rooms.
I hadn't thought of like just kind of doing away with most of the waiting room experience completely, but I mean that sounds like a great idea to me.
Yeah. I mean, I think it's so much more comfortable to hang out at least for me, like, I definitely feel that it might be more comfortable to, hang out in your car and listen to your music or, whatever. And then when it's your turn, your time to go in, then, obviously you go in. But yeah, I agree that doing away with waiting rooms would be not a bad idea. And not to mention too, the potential for spreading disease too, between animals to animals, but also between people to people. And this, like, even in human waiting rooms, going to the doctor and everything.
Yeah.
I mean, it's not a place I like to hang out.
Yeah. Well, how many talks are there out there about how to make your waiting room a nicer, happier, more calming place? Like, that's a great idea. I know how to do it. Just let me sit in my car and watch Netflix or something.
No, you just can't. I mean, no one is really relaxed out there.
Maybe especially in like the exotic stuff, because you have a macaw beak trim going on in the back. And so the macaw is screaming. And then you have 4 rabbits in the waiting room who are now utterly panicked because it went from being like 5 decibels to 275.
Yes, whose white blood cell counts will normalize in approximately 6 hours. And that
Yes.
there's actually science to show that. Like their white blood cell counts are not going to be normal today. They just won't. So great. That won't affect anything except for, most of what we're doing. So cool. Yeah, we'll see. I mean, I think clients really want it back. I think they like that one-on-one. I think they like body language. I'll say like this the other day, I was really bummed I couldn't show a client an x-ray in person. And it's just a minor thing, right? But it's so much nicer to have them in the room and be like, can you see how this is shaped? And let me explain to you why it's different and what that means. I think when you can, like you were talking about, Cass, like showing them a lump or a lesion or a mass or how it's affecting their pet, I think that's so much more real to the clients then, because it's not just words.
Right.
Like we talked about names go in and out of heads, terms go in and out of heads, but pictures, they stick around. So
yeah, I mean, I can't wait for us to go back to normal. I think that vet med is so much as it is animal relations, it's still 90% dealing with people, and without being able to make those connections, I feel like even though a lot of clinics have seen huge spikes in client numbers during the pandemic, you haven't really been able to make that doctor-patient relationship that's going to make them want to come back and see you and make sure that everything's still going to plan, because they haven't really seen what you're doing when their pet's inside. So they might not really get the connection of why it is so important to come in for annuals.
To add to that too, I think you're right, Amelia. I think that's when relationships are formed. I think that's when clients get attached to their veterinarians. And it's one of the things that it's almost like a weird art form. And I'm going to warn you, you're not perfect at it when you get out of school, but all of a sudden you start to pick up little cues and people's body language and other things. And then all of a sudden they don't just see you guys as a medical provider. They see you as their vet. And when you become theirs, it's a double-edged sword, don't you? Like you become theirs. They like, well, I mean, these are the people that bring you cookies at Thanksgiving when you're trying to lose weight, but also like send you flowers and do wonderful things for you. But they're also the ones that call, at 3 a.m. and are wondering why you're not up waiting for them. It's, and most people have good boundaries. I say that, knowing that 90% of our clients out there really do have good boundaries.
Sure. Yeah, I don't know. Definitely. I like having clients in the room and talking to them, and transitioning to a new hospital in the middle of a pandemic where you're curbside. That's been an experience of like, try getting people to trust you in that scenario it's hard. But I feel like throughout the course of this, we've heard, stories about damaged relationships between veterinarians and owners, and just, not being able to connect and bad things happening as a result. And, then we lead into mental health in the profession and stuff like that. I feel like a lot of the stuff we're talking about, that nonverbal communication, like you were talking about picking up on those little cues and practicing that weird art form, is such a big part of the job. And that just like went away cold turkey. And all of us clients and vets and, technicians, CSRs, everybody, we're all kind of left going, okay, what do we do now? And I wonder if that's where some of that comes from.
Yeah. I think also part of it is like, if you talk about, especially for the phone or the clinics that are doing phone consultations, it becomes so much of what you wouldn't say to someone face to face versus what you would say to someone through a screen or online. The margins are just ever expanded. And I don't think that I'm an excellent communicator by any means, but generally speaking, I've never really had client relation issues. But over this past summer when I was working, I got my head chewed off about 4 times when I literally didn't do anything different than what I would have normally done. And it was, I mean, I think that nonverbal and just having someone actually in front of you really makes a huge difference.
So this is a great example, but like you pick up on so many cues when you're going over like a treatment plan. And if you get stuck doing estimates as a vet, like you'll bring up something and you'll watch people's reactions. And if they're excited, they do all the nonverbal things. They lean in, they look at you, they're nodding, they're doing all those things. Whereas if all of a sudden they start to to pull away. Their shoulders get hunched. They start to like, all of a sudden their shoes become the most fascinating thing in the room. Or some of them just start crying. You can't hear it. They start crying though. You know right away. I mean, you don't have to be a genius to figure out something's wrong. Wait, hold on. Now I proposed this idea to you. You're clearly, maybe you're upset, maybe you're overwhelmed. Let's take a step back. Well, when you're doing that over the phone or even in the car, some of the cues, no matter what, are lost. You can't see people. You can't see them the same way. And you can't take that minute to go, hey, before you lose your mind or before you become really upset, whether it's out of fear, anxiety, or anger, let's hold on, like pause, time out. Let's step back. Maybe there's background you don't know about. I don't know about. Maybe you had a relative with the same disease and you're freaking out. Like it's gone. And so of course you don't get the warning. You don't get the warning before people are just done emotionally for whatever reason.
And in that vein, I feel like whether we're curbside or not, one of the areas that I've had success with is opening that door for people. And, especially when you can't get those nonverbal cues, but going out and saying, in an ideal world, this is what I want to do. And if that's not where you're at, then this is a conversation. I want to hear what you say. If you look at me and you go, Doc, it's not going to happen. Pipe dreaming. No, that's okay. You can tell me that. And I'm here to have a conversation and work out a plan that's best for the two of you. So definitely during curbside, I've found like you got to just open that door for people. But even when you're not curbside, because some people are really good at hiding it. And I agree with you. Most people have a tell and you can go, okay, no, we're not on the same page here, especially as a veterinarian who, we work with animals. So we have to pay attention to these nonverbal cues, but some people are really good. And like,
don't play poker with us. Don't play poker with us.
No, don't.
We'll pick up on it.
Have you ever had that though, where like you think you had a good conversation and then all of a sudden like every follow-up is canceled after that and you're like, what happened?
I mean, some people are really good. No, I agree. You've definitely had that. Or you thought great exam, great consult, everything went great. Yeah. And then an hour later they call and they're like, I hated that. Everything about that was terrible. And you're like, cool. So missed that one. Oops. Yeah, it's definitely worse. Curbs or phones, they just don't do that. They don't do that.
Yeah.
And I think it's 10 times harder when you first graduate because you're learning people's cues. You have no history with them and you don't have any history yourself. So like it's always challenging on emergency because you usually have no history with the person in the room to begin with. But then if you don't have like this whole encyclopedia of reactions people have given me over the years that mean this, it really adds to it. And it is a skill. And people say, oh, they don't prep students for that. I don't think you can. I don't think you can. You can hang around in a clinic and watch it happen, but until you're the person that they're staring at and they're going, what are we going to do? And they're staring right at you and you're going, I'm going to go look that up. Hold, please. It's different. It just is. And it's okay. That's part of the learning curve of coming out of school. And it's why you need good mentors to help you through that weird moment.
Yeah, I definitely the mentorship in that regard. And I feel like we've taken this whole other turn, like now I feel like I'm like, and this is what you should know when you get out of school.
Good to be warned. Yes.
One more thing I would add is really, especially, in this time where things are so much more difficult, really just letting people talk. And it takes a lot more time. It's a lot more inefficient, but having more of a conversation rather than like, okay, I saw X, we're going to do Y, and then I want to recheck you, whatever. Like you had a relative that had the same disease, or, you want to do all these things because you love this pet, but your family member has cancer and you can't financially because of all these other things going on. And you'll find those things out. And that then helps like build that encyclopedia of responses from people. And you can really tailor that to them. And that's where you become, their vet. It all goes together. Circular conversations, right?
But, I've gotten better at that through curbside. You know what I've done. And it's a little like efficiency tip too. Is sometimes you just shove the phone under your ear and you start your record and you let them talk it out. You're like, okay, yep. Mm-hmm. Oh, your grandma. Oh, yeah. Wow. And, in the meantime, you're like, dog presented for vomiting 3 days ago, you kind of have to like left side of the brain is working on record, right side of the brain is expressing sympathy for something that is completely unrelated, or just trying to be a good listener. It's a little, and sometimes you nail it and sometimes you're like, what happened?
That's honestly one of the things that I think in working with you, Dana, that you do really well. And it's something that I admire about you, because when you're talking to clients, you are both extremely patient, and yet also you manage to redirect them back on the right track much sooner than other people that I've worked with. And I don't quite understand how you do it, because you do it in a way where you're supporting what they're telling you, whether it's completely unrelated or not. And somehow you just manage to swing it right back around to what you wanted to talk about in the first place.
Dude, that's like the best compliment I think I've gotten in a very long time. Thank you so much, because sometimes you're on the phone with clients and you're like listening to them and you're literally at your desk going, yep, I'm never getting off the phone with them. Oh my God, I just heard about something that happened in 1974. But at the same time, like Cassie said, you just sometimes you have to let them talk a little bit. It's a balancing act between
it is
enough listening and enough, okay, all right, we're done. Circling back around to today, and what's happening
enough information,
now.
where they're coming from, but hopefully without making your next patient wait too long.
Yeah. And it is funny because we talk about this and it seems like, I know, what one of the things you guys are worried about is, oh, this is going to be only applicable to small animal. I will say this, having externed in zoos and worked with wildlife and, things like that, those keepers or those caretakers in whatever way, shape, or form they come in are the same way. There's just as much evidence that they are just as bonded to those animals as if they were their dogs and cats. So yes, the tiger, if let out of the cage, will eat them. Doesn't matter to them. It is in their care, and they're deeply worried about, the animal. And also whether it's a zookeeper or an owner or a wildlife rehabber or a farmer, it is really interesting to me that I do think it's really important as a vet to respect their knowledge of their animal, and it's easy to think they're talking crazy. Sometimes they are, but they're not. They know what happened 3:00 yesterday. You don't. I mean, you weren't there. I do think there's that listening skill, like Cassie was talking about, that's so important. But yeah, you can't let them go on and on either.
And that team approach too,
yes.
of working with the owner, that you are not, and especially, as a new grad dealing with all the challenges, like you are the veterinarian making medical decisions right now, but you are not solely responsible for what happens here. Work with the owner as a part of the team to take care of this animal. This is the person who knows this animal better than anybody else and who is watching them and can tell you the little changes that happen at home. And did they eat? Did they not eat? They're full of valuable information that sometimes you have to tailor the amount of information that you truly need. But yeah, really viewing that pet owner, and of course I'm talking from small animal experience, but pet owner, keeper, whoever you're working with as a team member in helping you take care of that animal. And you guys are doing that together.
It also means, though, interestingly enough, it's not solely your success if things go well. You did it as a team, right?
Mm-hmm.
It's not solely your responsibility if things went wrong.
Mm-hmm.
It's, this goes back to you're a veterinarian. You're not a magical force being.
Yes, exactly.
You're only capable of so much. Yes.
So we briefly mentioned clinic culture. How do you guys recommend new grads going about finding a culture that they fit in really well with? Because I feel like that's such an important factor for burnout nowadays.
Trial and error, right? I mean, it kind of like we talked about your first job being a learning experience. I don't think what kind of culture you want to practice in and what works for you until you've really been in it and seen how you respond to that. And it probably is going to change over time. I know for me, when I first got out, I was like, let me do all the things. And, I don't care if I work, 6-7 days a week and stay late. And, I'm looking up things on my day off. And this is so exciting. This is so much fun. I still love being a veterinarian. I still want to give 110% when I'm in the clinic, but man, I got to go home and switch it off at night, and I have to have a general idea of when that's going to occur. And so what I've wanted out of a practice culture has changed over time. So I think you just got to get in it and see what works for you. And then, if that changes, then be open to that.
Yeah, I think this is probably like disappointing advice. I'm probably going to give really disappointing advice right now. So a lot of people talk about, going and shadowing at the clinic 2-3 days. And I don't think that's bad advice if you have the time and you can do it. And it's great because like you can get, if there's red flags or, it's worse than dating. You're not going to get married to your first job. You're not. It's okay. And again, so doing something like that is great, but you're not going to get the full picture in 2 or 3 days. I promise you. So if you can do something like that where you can hang around the clinic for 2-3 days. And the nice thing about that is you're going to interview with typically 1, maybe 2 people. You're probably not going to talk to everybody at the clinic, and they're going to have really different perceptions of how things are going at the clinic. I'd say this, don't plan on doing an hour interview. The longer that you can stay, the better. To be realistic, that usually doesn't mean 2 or 3 days. It's hard to do that all the time. So you can get a picture of it, but I guess I'm going to throw out what Cassie did. At some point, you're going to pick the wrong job. It's not going to, you're going to be like, this sucks. It doesn't fit with me. They're too formal. They're not formal enough. They're doing more in, more equine than I want to do. They're doing not as much exotics as I want to do. They're doing surgery and I don't like it, or they're doing surgery in a way I don't like, but they're comfortable. So the only thing mistake I've seen new grads make is maybe thinking that because their idea is so different than the clinic's, sometimes you get this impression, well, I learned, and so my way is the only right way. And it's hard because that's what you learned. And that it's still not that your way is wrong, but their way is probably not wrong either. So, there's a bend that you're not always super comfortable with because you don't have the experience to go, well, even though it's not gold standard, I know it's really, really good and I'm comfortable with it. It's hard. It's hard because you don't always have this, again, that encyclopedia of knowledge. So, but if you go somewhere and you're not happy with things, that's okay.
I think you make a really good point, though, that, the medicine is like this, right? That there's not one right way to do things. And so you may be in an environment where exactly what you said, Dana, you're just like, I don't thrive in this environment. This is not my comfort level. This is not my happy place for whatever reason.
It is really interesting. I practice with, exotics is pretty, the exotics clinic is pretty big, and there are 5 doctors there now. And in some, and this has happened at emergency too. Sometimes the way you practice is dramatically different than your colleagues. But it might be okay. Like they just do things different than you, and I can think of any number of examples of this. Some of us are more comfortable putting all GI stasis rabbits on metoclopramide. Some of us are not comfortable doing that. They like cisapride. Could you medically defend both choices? Sure. Well, sometimes we get a little cranky and be like, oh, I just want it my way. Yes, we will, And it's probably the most dramatic in emergency critical care situations because, and this always makes me laugh, because you can't be there 24 hours a day, right? So you hand your cases over to another doctor. And they change all the orders. And then you come in the next day and change all the orders. And then they come in that next day and change all the orders.
And you drive the technical staff crazy.
You do.
Like, would you two just communicate and make up your minds?
Your texts are like, what are we doing? But I think the lesson to be learned there is probably both ways are right. And the patient still gets better, even though maybe parts of their treatment plan are getting changed every 12 hours. It doesn't truly matter. You have to do what's comfortable with you. You have to reach agreements and compromises with your colleagues. And it's probably fine both ways.
Sometimes it helps to to see the other way, to say, well, I don't do it that way, but apparently we're doing it that way. So let's see what happens. And like you said, most of the time your patient's still going to get better. Things are still going to be fine. Every choice is still medically defensible. And you just learned that if you don't have access to cisapride and you have to, metoclopramide's all you have. I know nothing about rabbits.
Both good.
Maybe
Don't
that
worry.
works.
Yeah. It is really, I and the other interesting thing about this is I think every new grad needs to work with like one veterinarian that's just like absolutely amazing, but super old school at the same time.
Sure. And
because they have some odd skills. You're like, you're doing what? Like, for real? Like, I didn't think that was a thing. Okay, we're doing this. I worked with a doc on ER, and he walked like he's running around, and he was a great guy, but he was very old school. He liked new stuff. He was a really interesting person because he'd be like, what's new in this world? And he's very much kept up to date, but he had some like weird old school skills that just like were like mind blowing, because you're like, no one does that anymore, dude. No one. And I remember him walking by. I had this acute abdomen. It was a German Shepherd. I'm like, this is really bad. Like, this dog's vitals are all abnormal. I'm like, this dog's going to die, and I don't know why. And he casually walks by the x-rays. He's like, looks like a mesenteric torsion. I'm like, you can't see that on x-ray. No, you can't. They taught us in school, you can't see that on x-ray. You can't. So long story short, he was right.
Okay, but now I have to know, like, did the dog live? Did you cut the dog?
We did.
Did you save a mesenteric torsion?
No, God, I'd be like, I would have probably retired.
There you go.
Like 2 years out of school. I would have been like, that's the peak.
It. It can't get any better than this.
It was a really good case though, because I was probably about 2-3 years out of school, and very acute abdomen, unstable patient. I'm like, well, look, we have to go into surgery on your dog, and your dog's a really horrible anesthetic candidate. So are you cool with this? And they were like, yep, we know there's no other choice. And I opened that up, and I literally was like, everything just came out, and I was like, I definitely can't save this. No. And it was funny because I called him in, and I was like, dude, is this version? Is that what this is? And he talked me through actually looking at the base of the mesentery, and when you see it, you're like, oh, that's a giant knot. That's not supposed to be there. Wow. Yeah, this is not savable. Okay, cool. And, you move on. And it was a really sad case because but the owners were well counseled.
Well, and I'm also thinking of like a mesenteric torsion case that I had that was super sad euthanasia. So when I hear it, like, it just pulls on my heartstrings a little bit. I'm like, oh, it's a golden retriever.
All the scars.
Yes. Oh my gosh. And he had like this little boy was one of his owners, and he was so brave through I was ready to break down, and he's like nodding me. He's like, it's okay, you can go. I was like, no, I can't. It was so sad.
If you haven't cried during a euthanasia that a kid was tougher than you, you just haven't been practicing long enough.
I'm saying it'll happen.
It'll happen. Yeah. You leave the room, you're like hysterical. There's like a 7-year-old in there who's like, it's okay, doc. And you're like, really?
No kidding. Like you are explaining this situation to a T where he's like, it's okay. It's like, no, it's not okay.
Yeah, it happens.
I mean, how do you guys deal with, or how did you deal with your first big loss after coming out of school? I feel like that's not easy.
You can see not well by the head roll, and like, oh gosh, I still don't like thinking about it.
I think actually my first one was in school. Is that bad? Because like the one, like it stands out in my mind. It was clinics. It was a hepatic shunt patient, and it was an older patient, and it just went into status the next day. Aww. And best owners. It was a little black pug. It was so cute. Yep. And it's one of those things too where you remember their names. It's like, because now this was, I'm gonna really date myself here. This was 19 years ago, and I remember that dog's name and the owner's last name, because that's how permanent it was. And it was just upsetting. It's just upsetting but it's weird because you like, I look back and it was upsetting. It was a rare complication of a hepatic shunt surgery. And it's hard because usually those cases are something where the owner's all in, because if they weren't all in, and if it was, if it's something that came in really bad shape and you euthanize it, not to say that they don't mean something to you, because they do, but they don't stand out in your mind. It's the ones that you've been working on for days or did a big surgery on or something like that. And, you remember those forever. Mm-hmm. You warn every owner of every case that's even similar to like that, of the potential complication forever. It's a part of the trauma that sticks with you. But like I said, you never forget it.
It's funny that you say that about warning every owner of like every potential complication, because I had a dog, and fortunately he lived, thank you to the great Michael Scher who saved him. But his thyroid was low, but he had 8 million things wrong with him. He had horrible dental disease, all this stuff. And we treated, I think it was like dental, skin, it was all kinds of things wrong with him. And so we treated, but after anesthesia, he just wouldn't come back around. And, fortunately, this was an all-in owner, and she went to the university, and thank you, Dr. Scher. He diagnosed it was a post-anesthetic hypothyroid crisis. And I was like, oh, I'm sorry, what? And he treated that dog. And sure enough, like any dog that has even a remotely low thyroid, I'm just like, you have to know, like, we need to figure this out before surgery, because that one time something bad happened.
And I think the way you deal with it, though, is that you take that and you are better for knowing that. Like every case after that, you treat better. And you true. You're like you said, now I know we need to do something else first. I know that because of that, usually it's not a failure. It feels like one. I'm going to warn you. It feels really one, even though there's nothing that like Cassi could have done in that case. There's nothing that I could have done to prevent that. Every case going forward, you treat, a little bit more about. And every case that you lose, that you learn from, or every case even that is successful that you learn from, adds to your stockpile of stuff that you can do in the future.
Every patient you treat from there on out is going to be a little better off for that knowledge.
Yep. I feel like we need to bring the energy back up.
I know. I'm just like with these dogs. Like I'm thinking of a couple that, oh man, they just, and you compartmentalize because you have to. We're very good at compartmentalization, and you practice it and you get better and better and better. But there's some that, and it happened to me recently actually with a dear friend's dog who we treated. Dana, you probably know who I'm talking about. And oh my gosh, like we treated and man, we did all the things. And finally, like on that ultrasound, it turned out there was nothing we could do. And I went over to euthanize him after my kids went to bed one night. I left and I went over and euthanized him. And the night we cremated him, I took him with me when I left, and I cried the whole way to the cremation place, and I cried the whole way back to my house. And then I couldn't talk to this person for like a solid week afterwards because I was just like, I felt bad. I was like, why couldn't I save him? Even though there was nothing I could do. But there's some that as good as you get at compartmentalization, and you have to be good at it, there's some that you just can't compartmentalize. They just stick in your brain.
And you know what? I'm going to go back to accepting that. There's just there are things that respond exactly how they're supposed to. And then there are things. They read the book? Yep. They read the book. You're going to die, disease B, you're going to treat it with drug C, you're going to get outcome D. Perfect. Nailed it. Done. Moving on. And then you're going to see a very similar patient and you're going to do the same thing, and you're going to have a completely different outcome. And it might be, and it's interesting because some are going to be better. You're going to be like, why didn't this happen last time? Why? Geez. And you're going to have some that you're like, why isn't this working? And I think it goes back to, we know biology, right? Like two biological systems, they're not the same.
And then when you mix in pharmacology with biology and you try to make all these systems work together, they rarely respond the same way.
Yeah.
Do you also feel like riding the waves? And you guys, I'm so bad. I hope we haven't like hijacked this whole conversation. We're like,
oh my gosh, no.
I'll tell you about this. But do you feel like riding the waves? So I feel like I get on these waves where I'm like, I am a great veterinarian. I can treat all the things. I know everything that came in the door today, and I fixed it, and they're all doing great. And that happens for, I don't know, like a week. And then maybe if you're lucky, a week. And then you come down off that wave and you're like, I don't know what any of this is. Like, I feel completely incompetent. Who gave me a license? Like,
no, it's so true because like, again, I go back to emergency and you leave some shifts and you're like, nailed it. Got that one right. That one's leaving. Got that surgery done. Perfect. Figured everything out. No diagnostic mysteries here. I am Dr. House. Everything is solved. Sending things home. Better than a Grey's Anatomy episode. Everything lived. I'm out, And then you have other things where you're like, what just happened?
I love that you almost said then you have other episodes, because that is what it feels like.
It feels like you're literally like, I don't even know. I don't know. you like, and it's inevitably like something that you've treated 100 times, a blocked cat, and you're like, everything followed the rules. Everything looks like it should be getting better or doing, like it's the zebras that you encounter, which are rare. First of all, that's when you nerd out. You get like super oddly excited and you go home and you're like up at 3 in the morning.
Yeah. Can you believe it? And your
yeah.
significant other is like, shh, stop talking.
Don't care. Yes. Adrenal glands are not exciting to me at dinner. But, and then like literally you're like, you know what, but when that happens, that's when you have to have your team around you. Call your friends, call your boss, call everyone on your team and be like, what other ideas you have? Because everything in my lexicon has been exhausted. And this patient, usually with a really typical disease, is not getting better. I need new ideas. And that's when you can find those people, that's awesome. So
yeah, it sounds like it's just so important to have such a strong support network within, because as you guys very well know, the veterinary community, both at the national and international level, is not that big. And so it definitely sounds like it's very important to just have that support group within our community. And I mean, I know for a fact that once Amelia and I are at a school, if I have a client come to me presenting a bird, I can easily call Amelia up and say, hey Amelia, I have a bird.
Yeah, if you two aren't texting each other in 20 years and being like, hey, do you have a minute? I need to run a case by you. I'm going to be super disappointed. It will happen. It will happen. Like you have a few friends that you're like, dude, I need everyone around me. I need a new brain.
It's not vet school anymore. Like it's not a test where you have to have all the information in your brain and like regurgitate it correctly. It's not like, and then, you pass or fail. No, like it's not that anymore. So to pick up the phone and just say, give me the answer, like, tell me what I need to do next. That's okay. You're allowed to do that. Guess what? You're not in school. And now you can just call and say, all right, I need the answer.
Mm-hmm.
I mean, and the great thing about everyone who's a vet is we're all just dweebs.
Yes,
like even if I met someone one time and they called me and they were like, oh, Amelia, I have a turtle. I'm like, great. Let me tell you everything you need to know because I'm already excited because you're talking about something that I'm interested in. You know what I mean? So we're all just going to dweeb out on each other's cases and be super excited to help everyone anyways.
Yes, we'll probably provide more information on turtles than they ever want.
Marry that energy.
Yes. They're like, dude, I'm just calling to find out how to euthanize it. They're like, let me tell you about the natural history and what temperatures it prefers.
Yeah, I'm like, would you like to do like subcarapacial sinus? Would you like to do jugular? We have like 8 options. Peritoneal? Yes. Not really, because they have a coelomic cavity.
Yes. That's the word. We're like, in carapacial. Yeah, somebody said that to me about a turtle one time. I was like, okay, back up. What is that?
Yeah, meanwhile, we're the people, like, we should probably get t-shirts and it'll be like, I can tell you everything you've ever wanted to know about, and pick a random subject. And that's what's fun about working at, like, my job right now. All the specialists, they're like, let me tell you everything I know about the thyroid gland, or I will tell you everything you need to know about hoof health. But there's probably some sort of expert in every bizarre topic out there, and you could probably find them with just a little bit of work, and they will be more than happy to talk to you.
I definitely think that that's one of the main reasons why I love VetNed and I love our community so much, because as Amelia put it, like we're all just a bunch of dweebs, we all just love science and we all just love animals and people, and we're just trying to do our best to help and to learn as much as we can. And yeah, I love that.
We're all a bunch of grown, mature adults who are really smart but still can't walk past a puppy without going, oh my gosh, let me squish it.
Oh my gosh, I was actually running a few days ago, and there was a guy that was walking his really, really cute little German Shepherd mixed puppy. I mean, it looked like it was only like 12 weeks old. Oh. And I ran past and I had to stop, and I looked at him and I looked at the puppy and I said, your puppy is so cute. And he was like, oh, you can say hi to him if you'd like. And I was like, oh yes, please.
Yeah.
You said that because I was going to do it anyway.
Yeah. I was thinking today that it's funny that you talk about walking by puppies, you talk about jogging by puppies. I am a hazard driving. Is anyone else feel like this? Because I'm driving home today and I was like, sandhill cranes, oh my God. And I was like, wait, focus on the road. Focus on the road, Dana. Like, they'll be here all summer. Just because they're back now, calm down. Like,
we have 2 that live in our backyard. We named them Frick and Frack, and they're super loud.
yes.
I'm a little afraid for letting Wrigley out when they're there. Not sure what's going to happen with that. I don't know that he realizes how much bigger than him they are.
They're big. Yeah.
My other dog's smart enough, Patches will stay away, but Wrigley, I think, will be like, look, friends.
Scotland is all about the swans. And anytime I take my dog on a walk on the canal, swans everywhere. And she's like, heck yeah, new friend. And I'm like, they are not interested as they flare their wings and hiss dramatically at my 3-legged 30-pound dog.
Like, Mom, they're trying to play.
Yeah, even driving past cows or horses just standing out in their field, I'm like, look, horses, or look, cows. And everyone else in the car is like, yeah, cool.
And yet every veterinarian I know, that we are the people on the road trip, they are like, we'll call out cow every single time.
I have to say, like on the way to school, I mean, I drive past tons of cows, and every day my kids point them out, and it never gets old. Like, I'm never like, yes, I know there's cows. I'm like, I know, look at the cows. Isn't it cool?
Well, once again, we've gone over.
Well, so for Amelia and I, we like to ask a couple of questions to our guests on our podcast. So if you guys wouldn't mind, if we ask our 2 questions.
Yes, carry on.
Yeah. So mine is always, if you could go back in time, would you do it all again? Knowing what you know now.
Mine's an emphatic yes. I would still do it. Yeah. I mean, a lot of people go to college and get to do jobs. I hope I don't get emotional. But for me, this is and always been a calling. This is what I wanted to do since I was a little kid. I've had bad jobs, but that doesn't mean this is not where I'm supposed to be right now. This is it. This is the career I was meant to do. Highs and lows, they're going to happen in any job. I've come to accept that. Even bad jobs, that's fine. That's a bad job. That doesn't mean that this is not what I'm meant to do. 100%.
Totally agree. I mean, you took the words out of my mouth that I love being a veterinarian, and I'm not one that wanted to go since I was a little kid. I decided later in my educational career, and I can't imagine doing anything else. I absolutely love it. It breaks my heart when I see some of the statistics of people saying they wouldn't go back and do it again. I go, man, we got to figure this out, because you're clearly not experiencing what I'm experiencing here. This is great. And I hope that we can figure some of those things out and help in that regard. But absolutely, I would go back and do it again.
Well, and for me, part of it is the highs are too high.
Yeah.
Like, to be honest, the good, I'm not saying the bad isn't at times really, really bad. It is, but it's like not even close.
And for the very last question, if you could write a letter to your past self, to your vet school self, what would it say? Like first year, second year of vet school, what would you tell yourself?
I feel like I would tell myself to just really stay open-minded, that there's a lot of opportunities in this career, and it's going to surprise you in many, many different ways. And to just be open to those possibilities and maintain that sense of adventure of, it's a journey.
And I think for me, it would be not to take it personally.
That's good advice.
You know what? Some of this is a job, and some of it's economics. And it's not necessarily a reflection on myself and my choices in my career. If things don't work out, people make different choices, I need to change things. I think I took a lot of things personally at the end of school, first few years out, that looking back on it, I'm like, that wasn't on me. That was just the way it was going to be. No, either way. Part of that, part of it's growing up too, not even growing up as a veterinarian, just growing up in general. But yeah, some of it's just business.
I like it. I think that's really good advice.
I try.
Yeah, I think so many of us are just so type A that to not take it personally is so hard, because all of us type A people put our hearts and souls into everything, trying to make it absolutely perfect.
You can't take it personally. Sometimes it is just a job. Sometimes it is just money. Sometimes it is just that.
I feel like I tell a lot of people who are pre-vet that, where they're like, but it's what I wanted to do my whole life, and it's going to be this amazing career when I finally get in. And I'm like, you're right. It is going to be an amazing career, and I would not do anything differently, even if I had the chance. But you have to know, like, there's some days you're going to wake up and it's still going to be a job. And that doesn't mean you're in the wrong place. That doesn't mean, you made a poor life choice here. It just means either that day or that situation, it's a job. And it's never going to be perfect, and it's never going to be sunshine and rainbows all the time. So, either get through that bad day or that bad week, or if you're in a bad situation, then change it.
I think that's some solid advice for for everyone.
Easier said than done.
Yes.
But yes, that's what I would say.
All right, that's a wrap on our 2-episode discussion featuring myself, Dr. Dana Varble, and vet students Amelia and Kaitla. Now remember, Amelia and Kaitla also have a podcast called Vet the Unexpected, where they discuss alternative careers in veterinary medicine, so definitely remember to check that out when you get a chance. If you'd like to find more episodes like this, click on the Education tab on Vetfolio's webpage. As always, we'd love to hear your input on this session, as well as ideas for topics you'd like to hear from us in the future. Feel free to reach out to me at dvm@vetfolio.com. You can also visit my Facebook page at Dr. Cassi DVM, and you can find me on LinkedIn. And remember, if one animal is better off because of you today, it's a great day.